Hello, I'm Violet Platt, CEO of Palliative Care Victoria, and I really just wanted to take this opportunity to thank the board and the staff of Palliative Care Victoria for all the great work and leadership this year, and I especially want to thank all of our members and the people in the community that we have worked with this year, collaborating and forging new ways forward to ensure that all Victorians have the opportunity to live, die and grieve well. Thank you.
Hello everyone. My name is Heike Fleischmann and I'm the Volunteer Engagement and Capacity Building Manager at PCV. Here are some of my highlights for 2023 and 2024. We presented the findings of the PCV survey, a snapshot of palliative care volunteering in Victoria, at our summit, highlighting key trends and insights. During National Palliative Care Week, the launch of our video, Volunteering in Palliative Care, Give It a Go, was a huge success. It reached over 18,000 people and has already brought in 13 new volunteers within the first 6 weeks of its release. Our monthly network meetings have been a vibrant space for over 140 leaders of volunteers across 41 organizations. And face-to-face workshops have been especially popular. We facilitated a train-the-trainer workshop for 20 leaders of volunteers, followed by a successful accidental counselor workshop, where volunteers and leaders of volunteers got hands-on skills and insights. Being part of the Victorian statewide Disability Palliative Care Advisory Group, in an exciting first, we contributed to organising the Disability and Palliative Care Forum, bridging the gap between disability services and palliative care. And we secured funding to continue our collaboration with VALID, the Victorian Advocacy League for Individuals with Disability, offering workshops for disability support workers and peer-to-peer sessions that empower people with intellectual disabilities to talk about palliative care, grief and loss. It's been an incredible year, and together we are making a real difference. Thank you.
When you register for an event like this, for a PCV event, is there a certain experience that you have in mind that you're hoping to gain from attending the event?
The knowledge that it brings and all the information that, that they give us. Yeah.
Today is really just a refresher for me for Palliative Care Victoria. I work in a multicultural aged care facility, so it's really just for me refreshing where we are actually at with Palliative Care in Victoria.
Well, a few things. I'm really excited to hear about the new product that's being released by Palliative Care Victoria.
I'd like to know useful information about decision making for the elderly people when they at the stage of the end of life care. So what they would like to know and what decision they would make in the future for them.
I hope to get out of today's session is that we want to be able to care and support our residents who are going through the palliative journey, and there's always room for improvement, so I see this as an opportunity to learn.
This event for me is really important just to keep the conversation going, because it is the conversation that's so important at people's end of life when they're receiving palliative care, but even more so before that. Like, have the conversation early about what people want at their end of life.
This was a unique meeting of minds today. We got to see a great combination of aged care providers, specialists from palliative care, members of our hospital services, and a whole bunch of odd bods in between, and it was just incredible to watch everyone have great collaborative conversation, get motivated for the next few months of sharing this resource.
Hi everyone, my name is Tanina Gucciardo-Maschi and I'm pleased to be presenting a summary of PCV's community engagement activities for 23-24. Probably the biggest impact this year has been our capacity to dramatically increase the number of free community information sessions we've been able to deliver. Certainly welcoming 3 additional volunteer facilitators and introducing the use of interpreters has really meant that we've been able to significantly broaden our scope to include numerous multicultural, multi-faith groups. In this way, we've been able to reach over 840 members of the community with information about palliative care and advanced care planning. The additional volunteer assistance has also allowed us to increase PCV's public profile by attending more events such as expos, other community activities, and to exhibit at conferences. Of course, the whole team at PCV is involved in many forms of community engagement across our different portfolios, and with that, we are extremely well represented through numerous speaker engagements such as keynotes, workshops, presentations, webinars, podcasts, forums, you name it. Some of the highlights for me this year were presenting at various network meetings such as the Eastern End of Life Care Network and the Ethnic Communities Council of Victoria. So too, invitations to speak at the National LGBTIQA+ Palliative Care Community of Practice and the National LGBTIQA+ Healthy Ageing Conference, which we did in partnership with the AGMC. We were also spotlighted in a webinar with Polar on Language Services as an example of best practice in our communications with multicultural communities, something we can really proud of. During 23-24, we also continued to develop resources to support our community engagement efforts. So notably, our glossary of terms, for example, which we were able to publish in 16 languages, and the multilingual content of the DARD project, which we're continuing to work on. All in all, I can say that we had a very positive and productive year, and I really look forward to continuing to build on our accomplishments next year. Thank you.
Hi, my name's Tiffany, and together with my colleague Lynn Casey, we developed the Dignified and Respectful Decisions project, and I'm excited to share what we've achieved over the last 12 months. The initial brief for the project from the Department of Health asked us to partner with health services to develop a resource for families that talked to goals of care and end-of-life care planning, offering practical guidance and support when making decisions about ongoing medical treatment, hospitalisation and palliative care. From this directive, our project team, along with the invaluable support of our community and advisory groups, developed the Dignified and Respectful Decisions website and accompanying booklet. These resources were formally launched at a breakfast event in Melbourne back in February this year, alongside over 60 professionals from the aged care and palliative care industry. Following this event, we began an extensive engagement campaign, providing direct education to aged care staff and working with industry leaders to promote awareness about these resources. We also worked with a variety of local councils and seniors groups across Victoria to reach community members directly. This included attending a number of seniors expos, speaking to community groups and publishing information about the material through local news channels. As part of a dedicated marketing strategy, we commissioned 2 social media campaigns and worked with several professional marketing groups and publishers. Articles about the resources were published in popular magazines, including Women's Weekly, New Idea, and Better Homes and Gardens. We also promoted awareness through local buses across the state and participated in several local and national radio interviews. Reception of these resources has been resoundingly positive from both the community and healthcare professionals alike. Through the help of our project partners, the Dignified and Respectful Decisions resources continue to be promoted and shared by a variety of health services. The momentum brought on by the project has allowed Palliative Care Victoria to continue its engagement with the aged care sector, which is becoming increasingly more relevant as we prepare for a new Aged Care Act. As we celebrate the completion of the project's first funding cycle, we remain committed to maintaining and building on the relationships we've made with our aged care colleagues and the community.
And how have you enjoyed the day so far?
It's been very informative, very knowledgeable, and the guest speakers are amazing.
one of the best things about the event was Nola's story, where she talked about herself, her journey, her husband, what was happening, and that the things changed over the course of that. And so these resources are going to be so important that people can tap into and tap out of, when the time comes, so that they can make that end of life process a much better one, especially when their loved one has dementia.
I think this would be a great resource for families and carers out there to understand more about what palliative care is and how they can be thinking and planning ahead for their future, for their loved ones. Much is done about planning to live well. I think it's equally important to plan how our journey ahead looks like when health might take a turn, and supporting loved ones in that regard.
It's great to be here. I'm loving the conference. Bernard was amazing when he said that there's going to be a threefold increase in the next 6 years of the need for palliative care. The brand new facility that we've built is just will be busy straight away, it feels like. So it was great. He was amazing. I really enjoyed just the way that he framed up information, and he worked it through. So he was really good.
And I'm loving the work that's going on with Palliative Care Victoria, because they do focus on being empowered when dying. And as a person with a living experience, it's all about being empowered at all stages of life. So, great energy and having an absolute fantastic time.
Well, mostly I've met people that I've only spoken to on email, so it's nice to put a face to names, especially local people, and so that's been really good. And I've enjoyed the sessions, so it's been good.
Yes, because we work in the home care package program, and I think today is very useful information for us. And in the Vietnamese culture, the people, they don't like to talk much about the palliative care. Maybe they don't have much information about that. So I think this is an opportunity for us to get more information, more knowledge, and maybe we can, give more information to our community. Yeah.